This short video will introduce radiotherapy for anal canal and colorectal cancers. We hope it will answer questions and any initial concerns you may have. This video is not designed to replace the initial information provided to you by your oncologist. What is radiotherapy? Radiotherapy uses high-energy X-rays which are targeted precisely to cancerous cells in the pelvic region and, if required, lymph nodes. Unlike normal cells, cancerous cells are less able to repair any damage. Here you can see the radiotherapy machine and the treatment therapist controlling the machine. These diagrams may be useful to help you understand where the cancer is and the area to be treated with radiotherapy. On the left you can see a view of the female pelvis and on the right a view of the male pelvis. Your planning appointment. You will attend a CT scan appointment lasting 1 hour. Please arrive 1 hour prior for preparation. You will be asked to empty your bladder on arrival and drink 3 cups of water. We need you to have a comfortably full bladder for the CT scan and for each session of your treatment. You will be required to empty your rectum prior to the planning scan. The oncologist will use a scan to map out where the treatment needs to be aimed, and this will be your individual plan. You will be asked to remove all of your clothes from the waist down and change into a gown. Please breathe normally and keep still. It is important that you are relaxed. Your CT scan. For the CT scan, the radiographers will ask you to lie onto specifically designed equipment and move your pelvic area into the correct position. A small wire marker will be positioned on the entrance of your back passage. A few measurements will be taken and small marks will be drawn onto the centre and sides of your pelvis. The radiographers will let you know when they are ready to leave the room to start the scan, and they will watch you throughout the procedure from outside. If you experience any discomfort or feel unable to hold your bladder, please raise a hand. The scan itself only lasts 5 minutes. You will not see anything for the scan. It is very important that you keep still during the CT scan. Once the CT scan is completed, the radiographers will enter the room. The couch will be elevated, so please do not sit up straight away. At the end, you will be tattooed at 3 points around your pelvic region. These are small permanent marks which will help get you into the right position for treatment. They are like the size of a full stop. Contrast injection. Your doctor may request for you to have an injection of contrast for the CT scan. For some patients, this can be helpful to show more detail in the pelvic area. If you have had a contrast scan before and had an allergic reaction, you must tell the radiotherapy team before the CT scan. The injection involves having a cannula, which is a thin flexible tube inserted into your arm or hand using a needle. The contrast is injected via the cannula. The cannula is removed after a minimum of 30 minutes after the CT scan. You may experience a metallic taste in the back of your throat or a warm sensation during and after the injection for about 20 seconds. This is often concentrated around the pelvis region and, although common, will go away quickly. If you experience any symptoms other than described, such as tightening of the chest, tingling or breathlessness, raise your hand immediately so the radiographers may stop the injection and check if you are okay. What happens after the CT scan? You will be given a date for your first radiotherapy treatment, and this usually starts in 2 to 3 weeks. The time in between the CT scan and first radiotherapy treatment is used to check your individual plan and make sure it is ready to deliver. This is not a diagnostic scan, so you will not receive any results of the scan. It is only used to plan your radiotherapy treatment. Your individual radiotherapy CT scan. Here you can see 2 images of different radiotherapy plans. On the left we have a colorectal radiotherapy plan, and on the right hand side an anal canal and lymph node radiotherapy plan. The coloured lines show where cancerous cells may be and therefore where the radiotherapy treatment is going to be delivered. Your individual radiotherapy plan. There will usually be multiple radiotherapy beams used for treatment to the pelvic region. On the left is an image of a patient having radiotherapy to the colorectal region. For this type of treatment, there are usually multiple short treatment beams being delivered to the region. On the right-hand side is an image of a patient having radiotherapy to the anal canal. For this patient, the radiotherapy is usually delivered in one continuous beam. No two plans will be the same. Radiotherapy is planned to an individual's body shape and diagnosis. What will the treatment look like on myself? The radiotherapy machine, called a linear accelerator, will move around you and deliver treatment to the required area. Your radiotherapy treatment. What happens on my first day of treatment? On the first day only, please arrive 40 minutes before your scheduled appointment time. Your first treatment will be approximately 30 minutes and subsequent treatments 15 to 20 minutes. Please use the signage to direct yourself from the main entrance to the reception area. Please check in at the reception desk and take a seat. One of the radiographers will come and speak with you. They will ask you to empty your bladder and drink 3 cups of water. You will need to hold your bladder for at least 30 minutes. This is what you need to look for. This is the LINAC treatment waiting area, and this is where you need to wait on your first day. How will I know when it's my turn? One of the radiographers will come and find you near to your appointment time for a first day chat. They will discuss the procedure and answer any questions you may have, and provide you with a list of the first week's appointment times. They will then ask you to change into a gown. Remove clothing from the waist down only. If you prefer, you can bring your own dressing gown. They will walk you into the treatment room and position you onto the couch. Am I in the right position? The radiographers will help you onto the treatment couch, and they will need to see your tattoo marks. You will remain covered as much as possible. They will adjust your body, the couch and the treatment machine to the required position. Keep still and relax as much as possible. Breathe normally. Once happy with your position, the radiographers will leave the room to control the machine from outside. You will be watched on CCTV cameras at all times, and they can communicate via an intercom. We understand remaining alone can be a daunting experience. Let the radiographers know you feel uneasy or anxious by raising your hand. They are able to stop the machine and come into the room. A short CT scan will be taken during treatment to confirm your position, and each patient will follow an individual regime. AlignRT. What is AlignRT? Patients naturally move during treatment, and AlignRT is a form of advanced technology that will detect motion during treatment using 3 infrared camera units. If you are to move even by a millimetre, AlignRT automatically pauses the radiation. Once back in position, the treatment continues. This ensures accurate treatment to the target area. The radiographers will inform you if this is part of your regime. Does it hurt? You will not feel anything. You will see a red light directed from the ceiling cameras onto your body. The red light will not affect or hurt your eyes, so you can keep them open if you wish. So let's dispel some common myths and patient views of radiotherapy. Is radiotherapy painful? No, radiotherapy is not painful. You will not feel or see anything during treatment, but you will hear a buzzing noise as treatment is delivered. Will I become radioactive? Radiotherapy does not make you radioactive, and it is perfectly safe for you to interact with others, including children, after treatment. Will the machine move on its own? The machine does not move on its own. It is programmed by the radiographers inside and outside of the room. You may feel anxious that you will be enclosed by the treatment machine, but this will not happen. The machine can move around you, but no machinery will press down onto you. Can I start and stop treatment as I wish? Radiotherapy is a commitment. Treatment is delivered over a Monday to Friday and, if needed, a bank holiday. Once you have commenced radiotherapy, it is crucial you do not miss treatment days, as this may make your treatment less effective. If you are unable to attend for any reason, please discuss with a radiographer or telephone your specialist cancer nurse. Your weekly review. Each week you will have the opportunity to meet with your consultant during your course of radiotherapy. Patients are encouraged to utilise this forum to express any concerns they may have whilst having treatment. Your consultants will manage your side effects and appropriate advice will be given. They are happy to answer any questions. Managing side effects. Radiotherapy affects people in different ways, so it is difficult to predict exactly how you will react to your treatment. Side effects generally only happen in the area being treated. Side effects occur gradually, and you will not notice anything after one session of radiotherapy. Side effects tend to start towards the end of the second week of treatment and will be at their worst 10 to 14 days after the course of treatment has finished. Most side effects are temporary, and generally people notice a significant improvement 6 to 8 weeks after treatment. Some side effects may last for a few months following treatment, and others which can be permanent. This can be discussed during your weekly review. Skin reactions. Your skin may become dry, tender and pinker in colour, similar to a mild sunburn. If the skin breaks, discontinue applying cream, keep the skin clean, dry and ask for further advice. Review radiographers can provide dressings to soothe itchy, blistered skin. What can I do to help myself? First of all, do not panic. The radiographers will assess your skin daily and refer you for specialist advice and, if needed, dressings. Utilise a moisturiser that does not contain sodium lauryl sulfate at least twice daily. Do not use this on broken skin. Avoid shaving or any hair removal on the affected area. Shower with a mild, unperfumed soap in tepid water. Pat the area dry, do not rub or scratch the area. Avoid applying hot or cold sauces to the treatment area. Wear soft cotton, loose clothing to avoid friction. Shield the area from direct sun exposure. Utilise a high factor SPF once radiotherapy has been completed for the first year. Urinary symptoms. The lining of your bladder can become irritated from radiotherapy, and this may cause a burning feeling when passing urine. Please let us know if this occurs so we can advise you further. The frequency of passing urine may increase, and you may also experience a greater sense of urgency. Drink plenty of fluids, avoid caffeine and alcohol. Drinking cranberry juice and lemon barley may help settle irritation. Avoid cranberry juice if you are taking warfarin. If you are unable to pass urine, let the radiographers know as soon as possible. Changes in bowel habits. You may experience a need to open your bowels urgently or more frequently. Diarrhea, discomfort and bleeding or mucus from the back passage and straining may also occur. This usually occurs due to radiotherapy irritating the lining of the rectal or anal canal. Please let us know if this occurs so that we can advise you further. Back passage discomfort. Towards the end of your course of radiotherapy, the skin between the legs and around your bottom may become sore. Let the radiographers know, as it is essential your skin is monitored regularly. Stop using a moisturiser as you are likely to require specialist products. You may experience some pain or discomfort. You are able to take painkillers such as paracetamol following the dosage instructions on the packaging. If the pain is not managed, please discuss this with your specialist cancer nurse or talk to your doctor. Fertility problems. This treatment causes infertility, which is permanent, and in women very likely to bring forward the menopause in 3 to 4 months after treatment. Your consultant may recommend hormone replacement therapy if your symptoms are troublesome. If fertility is an issue for you and your partner, please let your consultant know so that it can be discussed further with you. Late effects such as vaginal changes, erectile and sexual dysfunction can be discussed with your consultant or specialist cancer nurse. Tiredness and fatigue. Radiotherapy can affect your energy levels, your motivation and emotions. Your body will use a lot of energy over the course of treatment, and added to the travelling and anxiety of this, you may feel tired. Fatigue can continue after radiotherapy has finished and may last several weeks. We encourage patients to carry on with their daily activities where possible, equally allow time to rest. What can I do to manage tiredness and fatigue? Plan your day in advance and try to incorporate regular gentle exercise. You may consider working from home or alternating your working hours. Consider complementary therapies offered at the Royal Berkshire, such as mindfulness, aromatherapy and massage. Ask the review radiographer for more information about this when you start treatment. Maintain a balanced diet and aim to drink plenty of fluids, approximately 2 litres per day. We understand you may have apprehensions during the process of radiotherapy which need addressing. Don't be afraid to ask your healthcare team regarding hot flushes, emotional support, fatigue and other concerns. There are treatments and support schemes available depending upon suitability. Your follow-up appointment. My radiotherapy is finished, so what's next? You will receive a letter for a follow-up appointment with your oncologist approximately 6 weeks after radiotherapy finishes. Keep in contact with your clinical nurse specialist regarding skin reactions or any other concerns for ongoing care. For all inquiries, contact us at the Royal Berkshire Hospital on 0118 322 7872.